Trouble in accessing primary healthcare services in some of the most remote and rural communities in the Eastern Cape are said to be a thing of the past. The province today handed over 50 mobile clinics, with the bulk of the province's largely elderly population living in rural communities. These services are said to address the department's drive to improve its services, especially to these communities. The health conference also began there today. And for more on that story, we are joined on the line by reporter Unathi Bhinqose, who's on the scene there. Unathi, good afternoon to you. Do tell us more about the health conference.
Thank you very much, Alicia. Indeed, today was the final day of the conference that they had. I mean, it was just to review some of the work they have done over the past financial year, and of course, looking ahead to this financial year and what needs to be done. And of course, it culminated in the handover of these 80 mobile clinics. A very, very great initiative. I mean, it's been on the pipeline for a while now, and it has finally come into fruition, and it was much welcomed by those who are set to benefit from them. And as you have rightly pointed out in your intro, the majority of them will go to those rural districts. And chief among those, of course, will be the Alfred Nzo and the Tambo districts. Those are the districts that are piloting the National Health Insurance Program. And of course, we did manage to visit one of the villages in Buffalo City where they are also getting these mobile clinics. Of course, some of them have been operational in some areas, but today was just an official launch. And speaking to some of the villagers there at Moi Plus, where we were at a little earlier on, they say that since these mobile clinics were made available to them, they have literally transformed their access to primary healthcare services. I mean, we had a word with a woman who has a 5-month-old baby, and she says that prenatal, I mean, those mobile clinics came in really, really handy because she had to travel long distances to access clinics, because it's not every village that has a clinic. So this has been a very great initiative by the health department. They say that it costed them about a million rands to make sure that these mobile clinics are available. It's a total of 85. The majority of those will go to the rural districts. Of course, they'll be distributed to all the 8 districts in the province, but they are biased towards those rural districts like Amatole, Alfred Nzo, or Tambo, and so on.
Wow, Unathi, 80 mobile clinics being handed over. But do tell us, I mean, how big a problem is accessing healthcare in these remote areas?
It is a major problem. Even these mobile clinics, I mean, them alone are not going to solve some of these problems. We know that down here in the Eastern Cape, I mean, it's not just the issue of availability of healthcare services. I mean, we have rural areas here that are not easy to access. I mean, we talk about these things every day. I mean, come elections time, we'll still be talking about areas that are not accessible to vehicles. Meaning that even these mobile clinics may not be able to reach certain areas. And of course, there's the issue of the availability of nursing staff that will be operating these clinics. We probed the department on that, and they sound very, very confident that they will make sure that there are people. In fact, there are people available already to operate these mobile clinics. Nurses are available. I mean, we're at Fort University only yesterday, and of course, there are a lot of nurses who are graduating there who are bursary beneficiaries from the health department, and they are set to join the Eastern Cape Health Department, and we'd expect that some of them will probably join these mobile clinics. But of course, it has to be a multi-department approach to ensure that they actually do what they are intended to do. We have to make sure that there are roads available to access those areas that are currently inaccessible, to make sure that these health services are available to them. But of course, it is a great initiative, one that needs to be applauded. And speaking to the villagers, they say that since they started being operational very late last year, I mean, they have changed their lives quite significantly. So speaking to the health department, they say that they are currently in talks with the roads department to make sure that they're making easy access. I mean, the building of roads to rural areas is sped up to ensure that they are able to access those areas that are currently inaccessible. I mean, some of the villagers had to travel very long distances, crossing rivers in order to reach these clinics, and some of them ended up defaulting on taking their medication. I mean, those who are suffering from chronic illnesses like your TB, like your HIV, they ended up defaulting. And we do expect that with these mobile clinics, there will be a change in that, and of course there will be an improvement in people's health also.
Great news coming from Unathi Bhinqose, live to us on the line from the Eastern Cape.